my name is Emily. I'm going to be your student nurse for today, okay?
Yes, ma'am.
All right, so we're going to do your dressing change on your central line. We're also going to give you some medication and draw some blood. Is that okay?
Yes, ma'am.
All right. Miss Mary, if you will, verify your name and date of birth for me.
Mary Doe, 11/13/1977.
All right, I'm just going to verify that to the orders. Perfect. Do you have any allergies to any medications or anything?
Not that I'm aware of.
All right. So during the dressing change, I'm going to place a mask on for me, and I'm also going to place one on you, okay?
Yes, ma'am.
All right. If you'd like, you can turn your head to the side away from the dressing as well.
Okay.
I'm going to raise your bed up. All right. Hand hygiene. All right, I'm going to place my gloves on. All right, and so we change these dressings at least every 7 days for hospital protocol, along with to prevent infection, okay?
Okay.
All right, so I'm gonna get everything set up. All right, first I'm gonna remove the dressing. I'm sorry the tape hurts. It's the worst part of this. And make sure that I secure the line.
Ow.
I'm sorry. I'm gonna make sure I secure the line so it doesn't come out.
How does it look? Does it look good?
Yeah, it looks good. So there's no drainage. Is there any pain when I touch around that?
Nope, I haven't had pain the whole time.
Awesome. All right, so no swelling, redness. I'm gonna measure. All right, so that's gonna be 1 centimeter. Perfect. That's the same as it was documented last time.
Good.
So we're gonna clean. I'm gonna change my gloves. Hand hygiene. All right, so I'm gonna put on my sterile gloves. Maybe. All right. So we're gonna make sure that we clean at least 2 inches around, side to side. For at least 30 seconds. All right, so we're gonna dispose of this. We're gonna let that dry. Now we're gonna place our little ring on. We have a protectant barrier. Place that on there, let that dry. Alright, so we're gonna now secure that. And then we'll place our dressing on top. Are you doing okay?
Yes, ma'am.
All right, perfect. So I'm gonna clean up my mess. I'm gonna write down the date and time along with my initials and label her new dressing. Get rid of all of this. Remove my gloves. And perform hand hygiene. All right, Miss Mary, so it looks like we have an order for 1 tube of blood, okay? All right, so I'm gonna get all of that out. I have my biohazard bag along with my tube for the blood. All right, hand hygiene. I'm gonna put my gloves on. All right. So we are going to unplant that. We're going to scrub the hub. We're going to pull back our discard, so at least 5. That's our discard. And scrub the hub again. Alright, so now we'll pull back our blood. Make sure we keep this separate from our discard blood. Alright, we will scrub the hub. And we're going to flush. Alright. And we'll scrub the hub again. And we're going to recap. Alright. So now I'm going to take the blood and place that in the tubing. Alright, I'm going to make sure to label my tubing. Place it in the biohazard bag to go down to the lab. So I'm going to dispose the discard and anything else needed in the biohazard. Clean up my mess. Remove my gloves. And perform hand hygiene. Alright, Miss Mary, so for the last thing for this morning, we're going to give you your medication, okay?
Okay.
Alright, so if you will, verify your name and date of birth for me one more time.
Mary Doe, 11/13/1977.
Alright, scanned her bracelet along with the medication. So it looks like we have some amoxicillin for you. So we have 1 ml. Alright, no restrictions on how to be pushed. No allergies to amoxicillin in the past, correct?
No, ma'am, not that I'm aware of.
Alright. I'm going to perform hand hygiene again. Get my gloves. Alright. Make sure we're unclamped. Scrub the hub. Alright. So we're going to pull back. Just make sure we have some return. And then we'll flush to make sure the line is patent. Perfect. So we'll scrub the hub. We'll make sure that our medication that we drew up already we've cleaned the hub to the medication. We've drawn this up into the syringe and it has been labeled. So after scrubbing the hub, letting that dry, we're going to grab our labeled medication syringe. All right, push that, make sure that we push it over the amount of time that the order states. Okay. We're going to scrub the hub. All right, now we're going to flush again. Scrub the hub. It's a lot of cleaning. Make sure it doesn't get infected. All right, so now we're going to cover that hub with a cap. All right, so I'm going to dispose of everything, clean up my mess. Remove my gloves. Perform hand hygiene. All right. How are you feeling?
I'm feeling good.
Good. All right, I'm gonna lower your bed back down. Here's your call light if you need me. I'm gonna go right over here to this computer and I'm gonna document everything from your dressing change, the blood draw, and your medication. Let me know if you start to feel any type of way, okay?
Okay.
All right. So I'm all done. Call if you need anything, okay?
I will do. You have a good day, Emily.
You too. And hygiene.